Hi there, thanks for joining us on this Sunday. The Prime Minister and Deputy Prime Minister and others were out selling their budget this week, making their pitch to communities across the country, but premiers were quick to point out what was missing from the budget, namely an increase in healthcare spending. BC Premier John Horgan is the chair of the Council of the Federation, and I spoke to him about health transfers to the provinces, the budget, and the sixth wave of the pandemic. Premier, nice to see you. I appreciate you making the time.
Happy to be here, Rosemary.
I want to start with some budget questions, if I can. The fact that in this budget anyway, there was no health accord or health transfer money even allotted or mentioned, only that there were going to be conversations going on. Is that concerning that it is not being telegraphed in any way, or is that sort of a normal part of negotiations?
Well, we were hopeful as premiers across the country, all 13 of us from the provincial capitals and territorial capitals across the land. We were hopeful to see a breakthrough in this budget, but it was made fairly clear by not just the Prime Minister, but the Finance Minister as well, that they wanted to set the table for the post-pandemic budget for the country and then build on that, of course, going forward. And so we're optimistic. We have been in discussions. COF representatives have been in discussions with federal ministers. The Prime Minister this past week out here in Victoria said that there were going to be discussions and more money for healthcare going forward. So we take him at his word, as well as the Finance Minister and the Intergovernmental Affairs Minister LeBlanc, that we're going to be making progress in the short term. We have elections underway or about to be underway in Ontario and Quebec. Yep. That complicates our discussions, but all of us are of one mind on this, whether we're those who have elections behind us or those who have elections in the near term, that we need to get this done for Canadians. We need to be able to provide the services that they need, and we can't do that without stable funding. I
want to ask you specifically about dental care, but first let me ask you whether you saw the funding of dental care as I don't know, as a sign that maybe they don't want to be funding healthcare right now, or how you read that bit of funding.
Well, I think that of course we had a confidence and supply agreement here in British Columbia. Yes. There's one currently in place in Yukon. I had discussions when there were minority governments in New Brunswick and Newfoundland about how we could find ways to work to get stable governments in various capitals across the country. So I appreciate that Mr. Singh and Mr. Trudeau came to an arrangement between their two caucuses about how they would proceed. And I took great comfort in the fact that although they highlighted pharmacare and dental care, they both said that we needed a sustainable funding model going forward for all of the other services that Canadians depend on. So do I think would it be grand to have a national dental care plan? Absolutely. But I think we need to start with first principles, and that is stable funding so that we can do the hip replacements. We can have a human resource strategy for our primary care sector. Every part of the country is struggling under the weight of not having enough people, whether they're nurses, nurse practitioners, care aides, doctors. And we need to address that not by starting up a new national program, but focusing on stabilizing the national program that all of us as Canadians are so proud of, and that's our healthcare system.
Okay, so but they've said, okay, we're going ahead with this, at least for a certain part of the population, kids under 12. Do you have any sense of how that would work? Yeah. Is that something you would want provinces administering? Because it didn't really seem clear in the budget how it would work either.
Well, that's going to take some time to figure out, but we need to make sure that we fully understand the federal government does not deliver services. The provinces do. And this isn't a jurisdictional squabble, Rosemary. This is the way Canada works. And in order for us to have an effective national dental plan, it's going to be delivered by provinces. So we need to sit down and figure out how we're going to pay for that over the long term. And all of my colleagues are of one mind on this. Once we get to a place where we can sit down with Ottawa and come up with a solution that meets everyone's needs, not just give me the money, I'm demanding it, or I'm not going to be able to deliver services. That's not what we're about here. We know that the federal government wants to work with us. We want to work with them, but we got to get to a table.
I want to ask you about housing too. It was a big part of the federal budget, obviously a big issue in your province where there are issues of supply but also affordability. One of the things, again, that the budget suggested that it would tie access to infrastructure spending to actions by provinces, territories and municipalities to increase housing supply. Is that the role of the federal government, do you think, here to use infrastructure money that you would negotiate for projects that you see fit in your province, to then say, oh, but you can only do this if you also increase supply of housing?
Well, again, we're already doing all of that. For us in British Columbia, we have embarked upon a pretty aggressive housing strategy over the past 5 years that includes a speculation and vacancy tax that has driven out the flipping, the speculation that was underway in British Columbia when I formed government. Still exists in other parts of the country, and it's appropriate that the federal government work with provinces to address that flipping that's driving up costs for people. But what we all need to look at is how do we build the infrastructure, and in the case of British Columbia, this is transit, with density around those transit nodes that will allow us to bring down the cost of housing. We've got mountains on one side and an ocean on the other side. This is an enormous challenge for the development of supply in British Columbia, and we can't go with old models. We need new models, and any help the federal government will provide in terms of dollars to assist young people getting a down payment together, those are the types of initiatives I think the federal government can usefully do. But at the end of the day, we need collaboration on infrastructure between cities, provinces, and the federal government to build out the in our case, SkyTrain or whatever the transit systems are in major cities across the country. We need to make sure that we're building density, and that means collaboration with municipalities, not dictating to municipalities how we do this. And that's a challenge, and we're working on it, and we've had some bumps along the way. We have municipal elections coming in the fall. That'll make it more difficult, but once that's past us, I'm hopeful we can make real progress on housing, because we have a federal partner who now, at least after, I would suggest, a decade or so, or maybe even 2 decades, off the field, is now getting back in the game, and that's going to help us all across the country.
Let me end on COVID. You are just recovered from COVID. That was public, so I'm not revealing any secrets there. You've also removed most masking requirements, I believe. You've removed now vaccine passports. And the idea, like in other provinces, what you and your public health officer are saying is you have to sort of mitigate your own risks. But we also know that we're entering a 6th wave in Canada, and I wonder what you say to those people who believe that restrictions could have stuck around a little longer, given that we are with some pretty intense case counts at this stage.
Well, what we've seen is the case counts have been rising. I'm among that inventory now. But hospitalizations are stable. ICU beds are at the lowest they've been in 18 months utilization here in British Columbia. So we've seen lighter symptoms. I know I had very mild symptoms for my COVID experience. I've been triple vaccinated. When my time arrives, I'll get a 4th shot. I've got my mask with me. I wear it when I'm in a place to be concerned about those around me. And I think most Canadians are in that spot right now. We have extraordinarily high vaccination rates in British Columbia and indeed in Canada relative to other jurisdictions. When I see the challenges in Shanghai and in Hong Kong, what really troubles me is not these massive populations, but the fact that their immunization levels are so low.
Yeah, you still have a very low pediatric vaccination rate. I think it's the 2nd worst in the country, though, Premier.
Yes, but we're not seeing a lot of outbreaks in our K-12 system at this point in time, and if we are, they're mild. So again, Dr. Henry has been on the vanguard of policies since the beginning of COVID, and we've been very fortunate in British Columbia to have a public health officer of her caliber with her experience. And we've been taking her advice. I deliberately allowed her to be the face of this, because most people, when they're seeking medical advice, don't go to their politician, they go to their doctor. And that's what we've been doing in British Columbia to good effect. On the pediatric immunizations, those are family choices in many cases, but we haven't seen outbreaks in schools. Our BC Teachers Federation has been very active, aggressively promoting programs and policies to protect their members and the students that they care for every day. So I'm confident that we have enough people focused on these issues. Would we use some more money to have better HVAC systems in some of our older schools? Of course we could, but those are debates for another day. Where we are at COVID right now is steady as we go. Be careful, be kind to each other, and wear a mask if you're uncomfortable. I know I'm going to.
Premier, always nice of you to make the time. I appreciate it, sir.
Great to talk to you, Rosemary. Take it easy. Have a good weekend, the rest of the weekend.